I am grateful every day for Suzanne Delbanco's brilliance and her legacy. She made a huge difference at Leapfrog and really for healthcare in this country. And we are so proud at Leapfrog that she was our founding CEO, and we are so proud to carry forth the vision that she so clearly articulated and so brilliantly built for us in the early 2000s.
I first met Suzanne Delbanco in 2000 or 2001 when she was founding the Leapfrog group. And I remember seeing her in a meeting where she talked about the vision for Leapfrog and what they were going to do. And it really was incredible to me. It was such a radical vision. The idea that hospitals would publicly report their quality performance. But of course, it was clear that Suzanne very much believed in that, was very confident in that vision. And of course, through her hard work and the hard work of many others, she achieved it. So that's one of the things that really left an impression on me. And I saw it many times with Suzanne, how she was able to take an idea that may seem radical to some, but argue for it, make a case for it based on facts, based on a very persuasive point of view, and move the needle and make progress on some really challenging topics. Suzanne was always confident. She always knew what she was talking about. She was always well informed. She was never defensive about her point of view, but she always made a very strong argument, and we can see the impact that all of her work has had. She really pushed the boundaries of what was possible. And I think a lot of where we are now and a lot of what we contemplate in terms of trying to drive healthcare value were ideas that she helped to develop and foster and propagate. And so we're all the beneficiaries of that work. And we all certainly want to continue to build on the foundation that she established. For me personally, Suzanne was really a role model. Somebody I worked with off and on for 20 years, and now get to walk in her shoes as the executive director of Catalyst for Payment Reform. It's a responsibility that I take very seriously, and I can only hope that I can have half the impact that Suzanne did.
When I think about Suzanne, I think about her integrity, her straightforwardness, and her sensible radicalism. Suzanne was one of those people who saw the future and walked boldly towards it. But what I think is so amazing is that we would all characterize her actions as bold, courageous, and epic. But the sense that I got from her was that these were just things that she saw needed to be done, and so she did them. And that's what I mean about her integrity and also her humility. You know, Suzanne was someone who modeled for me not only a way of working, but a way of relating to myself as a mission-based worker with bold ideas.
Suzanne hired me as an intern at Catalyst for Payment Reform back in 2014 and offered me a full-time position after I finished my undergrad degree. As a boss and a mentor, Suzanne was extremely invested in her staff and giving us countless opportunities for professional growth. She gave me many opportunities to co-author publications and lead and co-lead major projects when I was still in my early 20s. She really encouraged me to improve my public speaking skills, which I was, very terrified of doing at the time, and I didn't have a lot of experience with. But she, in one case, gave me an opportunity to speak at a large conference in her stead. At the time, public speaking really was not my strong suit, but she really invested in a ton of time in helping me prepare for that conference. She wanted me to practice so many times that I was bored giving the presentation, and I'm sure at the point that I stopped practicing with her, she was rather bored too. But the presentation was a great success ultimately, even though I was still very nervous. But her investment in me and my skills I really valued, and it really improved my self-confidence. Suzanne was the soul of CPR and the reason for its esteemed reputation. She was extremely smart and well-informed. She focused on important topics such as hospital consolidation and rising prices far before it was a mainstream issue that was being discussed by the policy community. And she had all the right connections and always brought the top experts in on the topic at hand. She was quick on her feet, explained challenging concepts extremely well, and provided thoughtful responses to hard questions. CPR is viewed as a trusted source and nonprofit that produces policy-relevant reports, and this is because of the team and the work that Suzanne convened and developed. And I owe a tremendous debt to her as she really shaped my career and helped me hone my skills and abilities, as well as ignited my research passions. She encouraged me to pursue a master's degree in public policy and a PhD, which is the path that she took herself. And it really took me some time to realize that this was the right course for me, but I found that it was, and I wouldn't have a doctorate or be a professor at Brown University without her unwavering dedication and support. I will carry on her passion and her commitment to making healthcare more affordable through the work that I will pursue in my career, and I know that she's touched so many other people as well.
I first met Suzanne Delbanco when I was a consultant and I was working with a client on an RFP who just so happened to also be a CPR member. And they directed me to connect with Suzanne to obtain some RFP questions. And that initial introduction to Suzanne to CPR made me realize that she and that the organization were thinking 2 steps ahead when it came to healthcare strategy. Fast forward to some years later, I had the opportunity to interview for a position at CPR. I have been in this role for 7.5 years, the vast majority of it working with Suzanne, and have had the opportunity and been impressed with her leadership, her orientation to the mission of the organization, as well as her warmth just as a supervisor, mentor, colleague, and friend. One experience that left a lasting impression on me with Suzanne was that she was frequently called upon to provide expert testimony and write amicus briefs against anti-competitive provider behavior. In one instance, when she was asked about providing expert testimony, just before she did so, the provider settled, which demonstrated to me that one person or a small group can have an impact in challenging the status quo. In terms of her legacy, I think that Suzanne's legacy with employer purchasers will continue to grow. The strategies that Suzanne has regularly worked on, quality of care, outcomes, measurement, payment reform, are strategies that purchasers regularly have the plans manage or take a leading role, or other stakeholders as well. But these are some of the strategies within quality or payment that have led to what we see today in the healthcare marketplace as really disruptive purchaser strategies, such as centers of excellence, high performance networks, alternative plans, or advanced primary care. So in other words, the strategies that she has focused on has led to some of the very disruptive strategies that we see today, where other organizations have picked up the ball and have developed these strategies further. The impact that Suzanne has on me and on my career has been a very positive one. She's from working as a consultant to coming over to an education nonprofit in CPR, I've had a much bigger picture thought process when it comes to the healthcare marketplace and market dynamics. As working with her for several years, she set an example, a personal example for me in terms of being warm and genuine, again, as a supervisor, mentor, colleague, and friend. And then lastly, on the communication front, she holds communication in high regard, and I think I've really improved upon my oral remarks and my writing skills over the last several years, having had the opportunity to work for Suzanne.
I was the second employee Suzanne hired at the Leapfrog group. I started the Monday after 9/11 in 2001. Suzanne and I were both confident and opinionated women, which we were working under very stressful circumstances, trying to change the healthcare system, which means that not every day was sweetness and light. But Suzanne decided to invest in me. She organized regular lunches for the two of us, where it was forbidden for us to talk about leaps or rollouts. And during those lunches, we came to know each other as people. We learned each other's complementary strengths and forged a really strong partnership that based on supporting each other. Her way of managing taught me important lessons, and I think that my future bosses and my staff and probably even my husband benefited from what I learned from her. I was honored to have her as my friend right till the last day. And I carry her example with me every day since.
I've struggled with what to say about Suzanne. There really aren't enough words, and we know that she was very special. But what I would like to say is thank you, Suzanne. Thank you personally for igniting in me a passion that I didn't even really know I had, for actually working with the healthcare delivery system to help it transform, to put patients first, and to save lives. And as Suzanne always said, the beauty of what we were doing was that it not only saved lives, but it saved dollars too. And that is a real win-win. I also want to thank her for recognizing that since all healthcare is local and regional, that she needed a network across the entire United States of markets that were dedicated and had the same passion to seeing that vision come to life in their area. And that model still stands today. It's an elegant model that really relies on a national focus on setting standards, collecting information, publicly reporting results, and then working with those results in the markets themselves to affect real change. I also want to thank Suzanne for letting the Memphis Business Group on Health be a test bed for some of the early ideas that she had along the way. I loved working with our hospitals on maternity care and really understanding for a large employer the quality of care that they were receiving. I loved working with a major employer on a market assessment for new payment models and understanding what changes we really needed to make in order to be able to advance the work. There are many examples I could give that would sing the praises of Suzanne, and each of you have some of those for yourself. All I can do today is say I thank you, and I miss you, Suzanne.
I met Suzanne when I worked for Bruce Bradley at General Motors. Bruce was one of the original founders of Leapfrog, and that was when Suzanne was hired to come in and run the newly minted Leapfrog group. I moved on to Marriott, running their benefits, and stayed part of the Leapfrog board, eventually becoming board chair. In fact, it was when I was board chair that Suzanne moved on to CPR, Catalyst for Payment Reform. Still working with employers, still working on value and safety. Suzanne had a way about her, a conviction about patient safety that convinced employers to support the cause and many hospitals to do the Leapfrog survey. She accompanied me and other employers in the DC area to meet with the hospitals here to ask them to do the survey. And they did, and they still do today. It was a big accomplishment. I learned a lot from Suzanne, not only about patient safety, but also about working with stakeholders to support the cause. I still carry that with me today, and I miss Suzanne.
I first met Suzanne when she was a rising senior at Wesleyan, and she was spending the summer at Little Compton, Rhode Island, at the summer home of one of her professors, who just happened to be a friend of mine. She was probably maybe 19 or 20, attractive, smart, and the pizzazz, with the pizzazz of the young and the poise and focus of a professional woman. A couple of years later, when I had joined the board of this business-based health safety organization, both with the funny name of Leapfrog, who should turn out to be their first, and for a time being anyhow, their only employee, serving as CEO, recruiter, fundraiser, administrator, and publicist, but Suzanne. She handled those responsibilities with enthusiasm and skill. She got the business leaders, sponsors, to get access for her into C-suites and to see hospital executives or other potential company sponsors. Once she was in the door, however, the pitch and the persuasion were hers to persuade possibly reluctant hospital chiefs to fill out the Leapfrog survey on hospital safety practices and the data behind those errors and what those rates were like, all to be made public. This was not an easy task, but she did it with verve, tenacity, and passion. By the time she left Leapfrog to go to Catalyst, the organization had money in the bank, a solid structure, and procedures to produce thoughtful and well-documented reports about hospital safety, with a goal to make giant leaps toward reducing or eliminating hospital errors and improving, therefore, hospital care. But she did it not only with a commitment to the mission, which was there, but also a personal style of warmth, generosity, and kindness. Both Leapfrog and Catalyst were lucky to have the benefit of her leadership and can best honor her memory by making their goals of patient care that is both safe and affordable.
It is a real privilege to be asked to pay tribute to Suzanne. I first knew her when she joined Leapfrog as our CEO in early 2000. Some background leading up to her joining us. In November 1977, Chuck Buck from General Electric called a group of us from GE, General Motors, Pacific Business Group on Health, Bayer's Healthcare Action Group, together to address the high cost and less than optimum health care provided to our employees. From that meeting, we expanded the group to include many other major corporations and coalitions and began meetings to address the need to engage major purchasers in driving accountability and improvement in quality. The issue of patient safety rose to the top, and the group began working on giant leaps in patient safety, thus the origin of the name Leapfrog. We focused on the need for employers to measure performance, publicly report performance, and incent providers with a goal of driving improvement. We quickly realized that we were onto something, and that to implement, we needed a high-quality professional staff. Accordingly, we engaged the Business Roundtable to provide funding and support to make this happen. In early 2000, we hired Suzanne to be our executive director and CEO. Today's success would never have happened if it were not for Suzanne. She brought us from ideas and commitment to reality. It was Suzanne who executed our vision and hopes, and not only did she execute, but added so much to the leadership of Leapfrog. She recruited and led a small, talented staff and then led the official launch of Leapfrog in November 2000, creating national attention, credibility, and momentum. Some notable highlights of her 9-year tenure as our CEO: successful launch of Leapfrog, development and implementation of the hospital survey, development of the website with public reporting, incorporated NQF never events in our expectations, formation of highly respected expert panels so essential to Leapfrog's credibility, implementing regional rollouts, bringing purchaser expectations to local regions, developing evaluation tools, and so much more. How was she able to accomplish so much? Simply put, she is a really good person. Suzanne had a deep understanding of healthcare policy, financing, and delivery issues, and was very strong and professional. Most importantly, however, she was a very kind and compassionate person. Her legacy, simply put, Suzanne was a major factor in saving thousands of lives.
You know, I worked with Suzanne incredibly closely over the past 25 years as we shepherded two nonprofits, the Leapfrog Group and CPR, fighting to make the healthcare system a safer and better place for patients. We had a standing Friday afternoon call where we would scheme and write and fight vested interests together. Though Suzanne called me her mentor, I surely was mentored by her as well. To me, there are three words that sum up Suzanne's career, and those are: she changed history. Her work has made hospitals safer, and tens of thousands of people have been spared harm and are alive today due to what she did. Suzanne wrote me a personal note about the work we had done together recently, and I think it's appropriate to share it on this occasion. About Leapfrog, she said, "We turned an idea of transparency, that everyone had the right to know everything about their healthcare, into a national movement that fundamentally changed the way the healthcare industry operates. Like the man behind the curtain in The Wizard of Oz, we figured out how to use the voice of employers to pull the puppet strings and start the movement by pushing for hospitals to report to the public the truth about how safe and good they actually were. Although we didn't get everything right, there's no doubt that the leaps saved tens of thousands of lives over the years. No small accomplishment." Several years after that, CPR was founded, essentially to shake things up with payment reform, the same way that Leapfrog had done for hospital safety. Here's what Suzanne said about CPR. "Another 10 years, and we have fundamentally changed the healthcare system again. People have the right to know how much healthcare costs and the freedom to choose. And the idea of paying for providers for care without any attention to the quality of that care is now history. Price transparency and payment reform are here to stay. Again, no small accomplishment." There's an important thing to note, which is those who knew Suzanne know that given her just profound humility and unselfishness, when she said we, it really was she was the one that did that. No one can change the world the way Suzanne did without having a world-class set of skills. She was highly intelligent, creative, and compassionate, three skills that uncommonly coexist, but also pragmatic and efficient, two additional traits that almost never coexist with the others. And boy, could she write. Suzanne was the grant whisperer. Funders loved her because she always delivered. There was another part of Suzanne that people didn't know, and that was her courage. As nice as she was and as well-liked as she was as tough as nails. Leapfrog made public for the first time by hospital the 100,000 annual and preventable deaths that were occurring. So imagine standing up in front of the CEOs of some of the best hospitals in the country, Mass General, Stanford, Mayo, and telling them that Leapfrog was going to make public how many patient deaths could have been prevented under their watch. I spent the bulk of my career in two organizations that prided themselves on having the smartest, highest achieving employees in the world. And I can say without reservation that Suzanne is the most all-around talented person I have ever worked with. That something is missing just from that description of Suzanne at work and how efficient she was. Suzanne had a serenity. We boomers would call it her zen. There was something about interacting with her that always made you feel better about being in the world. You know, those Friday afternoon calls were the highlight of my every work week. And if Suzanne were here now, I think what she'd say is two things. First, all of us should savor what we had with her when she was around. And second, to never, ever stop speaking truth to power.
I first met Suzanne when I applied to be CPR's program director in late 2011, and I started in January of 2012. So here I am, almost 13 years later, still with CPR, and I'm so grateful for the chance, opportunity to go from a very large corporate position with hundreds of thousands of employees to being the third employee hired at CPR. So it's a great honor. I didn't think that I had the skill set that Suzanne and the board was looking for to measure payment reform, but turns out I did. And I'm so glad that she believed in me and I have this opportunity. Suzanne has left many lasting impressions on me. One in particular I think is so poignant about the role that humor plays in our life and in work and not taking things so seriously. She was on a panel in New York, and it was on price and quality transparency, and we were pushing for price and quality transparency back a decade ago, and we're still talking about it today. She's always ahead of the curve, and there was another person on the panel who was being pushed on transparency and made some reference to her being like the Taliban and being very fierce in her advocacy efforts. And I probably would have been frozen, but she's just so smart, so quick, just so clever with her words as she is in writing and speaking. And she said, well, I'm from Lexington, Massachusetts, so I'm a Minuteman, which I just found so just, I don't know, so clever, which was Suzanne. She's really impacted my career in many ways. I would not be where I am today without Suzanne. She started off as my boss, then my mentor, and quickly a friend. And I am here 13 years later, still measuring payment reform, still working on policy issues, and I'm very grateful. I'm a better writer because of Suzanne. I'll talk to reporters now, which I did not like to do when I first started. And I will say that in very tough situations, she taught me that they're tough for a reason, and working through that toughness and the challenges is what's going to make it a better product in the end. And so I believe that her legacy is going to live on in my work and CPR's work. She and the board had a vision for value-based payment, and I don't think we'll ever think about paying for healthcare without quality, without value. Our current executive director said, at some point this should just be payment. So I think that will also be part of her legacy, that it is just payment. I think about Suzanne often in my work, and she was so gifted in so many different realms, but she's just so gifted, and she was a gift. She was a gift to me as an employee, as a friend. She was a gift. She was a gift to CPR, and she really was a gift to the field.
A quarter of a century is a long time, longer than most people stay married, longer than most people stay in touch. And it was that long ago I first met Suzanne. She was interviewing for the role that would make her known in the industry and for which she had seemed born to do, leading Leapfrog. There wasn't even a logo, let alone a website, a formal survey, or any staff. And most importantly, hospitals in the US had never had to report on the quality or safety of the care they provided. But there was Suzanne, and it was enough. Her passion, her incredible intelligence, her poise when speaking in front of an audience of thousands of oftentimes hostile attendees made Leapfrog what it became and made patient safety reporting important, even essential. It was the building block on top of which so much has been built. CMS mandated reporting, price transparency, even alternative payment models. It's really difficult for me to see how any of those would have come about without Leapfrog. On a personal note for me, she was a sister from another set of parents, a friend and confidant. Over the years, we had countless walk and talks, and I cherish the memory of each one. We chatted about everything: life, work, politics, the present and the future. Suzanne was special, and I miss her.